A pledge from President Donald Trump's 2024 campaign still hasn't materialized. The promise centers on a growing issue in reproductive health, in vitro fertilization, also known as IVF.
And we need great children, beautiful children in our country. We actually need them. And we are going to be, under the Trump administration, we are going to be paying for that treatment.
IVF is a procedure where an egg is fertilized outside the body and implanted in the uterus, often used by people facing infertility. Because of its high cost, sometimes up to $25,000 per cycle, Trump vowed to make insurance companies cover it. In February, he signed an executive order to cut costs and expand access, saying he wanted to make IVF more affordable and more available. But months later, the Washington Post reports there's still no legislation, and White House officials say they can't legally require coverage without Congress. The Post says the administration is also restructuring its plans to mandate IVF coverage under the Affordable Care Act, which would impact about 50 million Americans. On the Hill, Democratic Senator Tammy Duckworth has introduced the Protect IVF Act. The bill would create federal rights for patients and providers, block unnecessary state restrictions, and let insurers cover IVF if they choose to. Across the country, IVF has strong public support. A 2024 Pew survey found 70% of U.S. adults say IVF access is a good thing, including majorities across political and religious lines. Meanwhile, the CDC reports U.S. births rose 1% last year, even as the overall fertility rate dropped slightly. For Straight Arrow News, I'm Kaylee Carey. For more on this story, visit SAN.com or download the Straight Arrow News mobile app today.